I am what's called a lower level dressage rider. I try to exercise and remain physically active because the athleticism that's required with horseback riding, lower leg strength, core strength. It takes a lot of cardio too. You're huffing and puffing out there, believe it or not. We have to consider ourselves as athletes. I try to ride at least 3 to 5 times a week and try to fit that in with my work. As a physician, you want to be in as good a shape as possible for your patients, and I'm on my feet a lot. I've had a number of sports-related injuries to both knees, either skiing or horseback riding. The most recent serious injury that brought me to this place was I had a tibial plateau fracture from a fall. I was told you will probably need a knee replacement at some point. Well, that happened sooner than I thought it would. As it healed, my leg became what's called valgus, where the lower leg beneath the knee starts to bend out. That affected my gait. It started to hurt more and more to the point where I was like, this is it, this is time. I saw Dr. Jenkins. He agreed because of the previous fracture and the arthritis that set in, I needed the knee replacement. He's like, I have just the joint for you.
In the past, these would be cemented into a patient, but these new technologies, a patient's bone will grow into these implants and hopefully provide a much more durable, longer lasting mode of fixation.
He wanted the joint that he placed to be appropriate for what I wanted to get back to doing. And it would withstand what I did, because getting on and off a horse, you do put a lot of stress on that knee.
That's the puzzle to solve, is what implant do you use? How do you do it in a way that you can fix her deformity? And then how do you get that implant to last as long as possible, knowing that she's really going to test it?
I just trusted him to do whatever he thought was right. He knew that I wanted 2 things. One was getting back to riding. 2, I didn't want to take a lot of time off of work. I was actually back in 6 weeks.
Everybody's different in what their goal is at the end. So you tailor your surgery and your implant to that individual patient.
An added benefit was the fact that he straightened my leg. That was very distressing to me. It hurt, and plus I didn't like how it looked. And he said, I'm going to straighten that leg out. And he did it.
When she fell off her horse, she had a tibial plateau fracture. So she broke the top part of her tibia bone. Where her fracture was resulted in a knock-knee deformity or valgus deformity. And it can make just the normal activities of daily life be difficult.
I mean, they're perfect. Everything is, symmetrical.
When I woke up from my surgery, honestly, I could tell right away that it was straight. I was so happy. I can still remember that.
As joint surgeons, it's our job to straighten these joints out. So it's not just putting in the implant, it's putting the implant in a way that is more functional than where the patient was before.
After my surgery, we have competed and we did very well. I have my blue ribbons to prove it. You cry. I mean, I had happy tears. It's such a connection. You just feel like you're home. I was hoping I wouldn't fall off again for a long time, but that did happen this past fall. She tossed me pretty well, and I needed to get that under my belt. Because you're always like, oh my God, can this joint withstand it? And it did. I rode today too. I stressed it, and it's fine. I don't even feel it.
Having had the replacement and telling me that she's happy with the appearance of her leg, that her leg is straightened, also that she's gone back to high-level horseback riding, and that she's also fallen off the horse, was, for me as a surgeon who spends a lot of time doing these things, really gratifying.
I share my journey with my patients. I've been through injuries, and it's hard to come back each time. What I tell them is fight the good fight. If you don't replace the joint that needs it, then your other joints are going to suffer.
She's an important example because it's not the end. If you are young and you have arthritis, even if you have had multiple operations or you've had other experiences, there's still hope that we can help you. My role as a joint replacement surgeon is to enable somebody. It's to give them that second chance and to start that next chapter in their life.
I do have patients who go up to Boston and I just don't know why. It's travel. What if there's a problem? As soon as I call, I get a phone call, come on in. He gives very personal care. He was very detail oriented. I felt safe. I'm very happy with the care that I've received here, and I refer most of my patients here.
Awesome.